Welcome everyone. My name is Elizabeth Dodd and I will be Chair and Moderator for today's webinar for the Community Care Smart Assistive Technology Collaborative. In today's webinar, you'll be given an insight into the learning of Scotland's Living It Up program. This webinar is part of a series of sessions being facilitated by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. Community Resourcing uses their international expertise and networks to build community capacity through empowerment, knowledge transfer, skills enhancement, research and development projects. Community Resourcing has been funded by the Queensland Government to bring together an online platform for community care service providers who are interested in collaborating on issues and practices related to smart assistive technology. Today's session will be delivered by Janette Hughes. Janette led the Wellness and Health Innovation Project and most recently the Scottish Dallas program, Living It Up, which focuses on the development of a transformational and scalable digital service model for the over 50s, focusing on co-designing services that enable them to remain healthy, happy and safe. With more than 20 years' experience, her expertise covers design, innovation, economic development and program management, specifically in the last 10 years within the health and wellness sector. Her current position focuses on how the visualization of big data will aid professionals and governments to plan and design new services for the future. Janette's passion is developing innovation that will benefit society. Please feel free to post questions in the question pane and there'll be an opportunity for these to be answered at the end of the webinar. Welcome, Janette, to today's webinar.
Okay, well thanks Elizabeth for your introduction. As you said, my name is Janette Hughes and I represent the Living It Up programme. I was programme manager for the last 3 years. For those that don't know about Living It Up, it's actually part of a wider Dallas project, Dallas standing for Developing Assisted Living and Lifestyles at Scale, and it's funded by Innovate UK, the Scottish Government and the Economic Development Agencies of Scotland. Today's webinar really focuses on the journey for the last 3 years and talking about harnessing innovation to meet the future needs and expectations of the over 50s. For those of you that don't know about Scotland, the population of Scotland is just over 5 million. We have 14 health boards and 32 local authorities. We have a very stable government and we've got quite a lot of population living in the rural areas and remote locations within Scotland. What's interesting is that Scotland is very much focused on trying to develop health and care innovation and has actually moved a lot of policy in the last 24 months to actually integrate health and care. It's also moving towards a person holding their own record and developing new innovations to help this sector. Living It Up was developed to transform healthcare and wellbeing and really looked at new models of care, focusing on the way our citizens actually interact on a day-to-day basis, whether it be booking a hotel, booking travel accommodation, doing their banking, or communicating and socialising with friends and family online. So we very much looked at the new models that were coming out from the digital platforms and focused on the person within the community. Another key element of the Living It Up programme was that we were looking at utilising and enabling citizens to use their own devices. So one of the key principles is very much familiar technology around not just how can we look after them if they have a long-term condition, in which if you're over 65 in Scotland, you usually come to the clinical service with 3 long-term conditions. But not just about that, but also trying to bring it downstream to actually look at the wellness and the health market, actually actively trying to prevent people getting long-term conditions later in life. And that's why it was important for us to start at the age of 50. The vision very much was to develop new models of care and focus on a self-management and prevention hub that would actually cater for our ageing demographic. So as I said before, it was to deliver a digital health and wellbeing service for the over 50s using familiar technology. And we had an ambitious target to actually cater for up to 55,000 people by the end of 2015. I'll talk a wee bit about how we got on and some of the services that were developed to meet this need. Firstly, and importantly, I think models around the world are looking at how they shift the power, and rather than the old-fashioned and traditional models where it was a model that looked after patients, but the doctor was very much empowered, it's actually moving it to an empowered citizen. Traditional models rely on the doctor and the medical care system diagnosing, referring, giving the right information. Also, the doctor, the clinician or the care actually trying to navigate the health and care system, and usually the interventions are reactive rather than proactive, often fragmented depending on where you live, and little incentive to actually enable it with any technology for that citizen. So Living It Up was very much trying to move and shift the model to a much more empowered citizen, where patients were informed prior to having a long-term condition of how they could avoid it, so looking at the wellness agenda. And also co-design and co-creation was key. What we did in Living It Up was actually push the boundaries and actually trying to implement and engage with the communities in Scotland and develop services that fill their needs and learn from their activities on gaining services from the sector. Technology is obviously here, and we found out a lot about, through the engagement process, of how people wanted to use technology to engage with services, and really the outcome being to deliver new and sustainable business models enabled by technology in some cases. Living It Up actually had a very ambitious vision, as I've detailed, but it also had one of the largest consortiums within the Dallas programme in the UK. It brought together two key areas. It brought together service innovators and technical innovators. And from my experience prior to Living It Up, what I often found was that technology companies were isolated from end users and service providers, which meant they often developed products and innovations in the dark and didn't really appreciate what people needed and what their requirements were. So Living It Up was very much about trying to converge two circles: the people that were receiving the service or actually providing the service, and those that were developing technology to allow citizens to live a better quality of life and self-manage. We had 32 stakeholders. On the service side, you'll see usual candidates in the 5 geographic areas. We had the health boards. We also had the local authorities. And within Scotland, it's important to say that health and care integration is now coming together. So rather than these being separated and isolated, these are actually being drawn together so that it will be one key service for the ageing population. Another interesting point to make when we talk about service innovators, we brought in new candidates to look at this. We brought in Glasgow School of Art, who's a world-leading service innovator. We also brought in Carers Scotland, which is a charity that looks after people that are caring for others with a long-term condition. And we brought in the Alliance that actually looks after people with long-term conditions. And why that's important is it brought creative and different thinking. But the real benefit of Living It Up is the real people that we spoke to. Living It Up was hailed one of the biggest co-design and co-creation projects in Europe, where we actually engaged and co-created and co-designed with over 3,000 people. And actually to get all of these people and actually link them up is key to the success of health and care integration in the future. When we look at the technology innovation sector that we chose a mixture. We chose candidates that you don't usually see, like TV companies. We chose digital companies. We chose mobile operators. We chose bigger companies like Philips and smaller, more agile companies within Scotland. So it was really trying to look at the whole ecosystem of health and care and wellness, and actually bring these people together to think differently on how we can solve the problems. From Living It Up, and from the community engagement team, we actually developed a new methodology. A methodology that hadn't been seen by the health boards or the local authorities in Scotland, to actually engage actively with real people within the community, to ask them what they required, to ask them to help us co-design and co-create. And we actually did this in a very agile and iterative way. So we used very small pieces of development, and we would then go back to our co-designers to work out exactly is that what they were looking for before we actually fully implemented Living It Up. Always testing and with real users and feeding back and refining the Living It Up model and digital platform. The community was vast. We had 5 geographic areas. So we started with engaging in real conversations with people, hanging out at community halls, supermarkets, places that people went for their shopping, to actually ask them what their daily lives looked like and how they could be improved. So it wasn't just asking people that were ill how we could help them. It was actually asking the over 50 population what they actively want to do with their lives, because most over 50s are still well, are working. We often call them the sandwich generation. They're looking after their children or their grandchildren, and equally having busy jobs and looking after maybe their elderly or ageing parents. So the over 50s is key to the success of a health and care and wellness project, because really that's what we're trying to prevent, them getting ill and having long-term conditions. We ran a number of workshops and used agile development to actually design, and having the technology people in the room was probably a first in Scotland. It might not be in Australia, but in Scotland it was a first to actually speak to end users and allow them to find their voice. So what they told us was that, and surprisingly I think for the statutory service, they said they wanted to get more involved in their health, they wanted to get more involved in their community, they wanted to give back. They also told us that often they found it difficult to understand clinical or health information when it was given to them, maybe a diagnosis or maybe somebody they cared for, and they were looking for much more personalised and local information presented to them specific to their needs. They also said, and this probably is one of the most frequently asked questions, will the over 50s or the over 65s use technology? When we spoke to them about technology, they certainly had technology. They had purchased either tablets, or their family had purchased tablets for them, or they were being upgraded to smartphones from their mobile operators, but they didn't have a good grasp of how to use it. And that's really one of the key areas that they asked. You know, we want to use technology, but we don't understand. So Living It Up took that as a key insight and challenge. But fundamentally, if they did come with a health and care issue, they wanted to access to more tools that would allow them to self-manage. So from all these insights, what did we develop? Well, you'll see in front of you on this slide the online self-management Living It Up hub. Now, what you'll probably be surprised about is this is a statutory service. It was run by the NHS and the local authorities. However, it looks totally different from what has gone before. It doesn't look bland, it's fun, it's engaging, and it's got lots of different areas for the user to go to and engage with. Everything from how to keep well to actually how to look after somebody or how to look after yourself with a long-term condition. And that's because that's what the community asked for. They didn't want to go to a bland, boring, one-way digital service. They wanted something that they could engage with. So the 4 services that were developed from the insights that were gained are pretty upbeat. The services look at how can you shine within your community, how can you discover more that's personalised to you, how can you connect with maybe service users, other service users, or connect with professionals, and how can you flourish to keep yourself well even if you have got a long-term condition. So again, very much focused on the person at the centre. The first service on this slide looks at Shine, and again it was about trying to be positive, trying to inspire people. A lot of the community engagement told us that when people retire, they feel lonely, they feel isolated, they feel their structure's gone, maybe a lot of what they did on a day-to-day basis had then gone, and they wanted to feel part of the community again. They wanted to feel that they were worthwhile within the community. So there was 2 aspects of that. The first one was they wanted to do things that were fun. They wanted to re-engage with hobbies. They wanted to re-engage with community. And one aspect that I think is worldwide is social isolation. When people get older, depending on what age they are, they become more isolated. And that was one element that Shine was trying to tackle. They would go through a quiz, it would be 8 questions, so it's very much driven by photographs, because again they wanted it to be fun. And at the end of that, the important point is it was personalised to what they answered and also where they lived. So if they answered that they enjoyed sports, arts and crafts, and maybe they had some time to volunteer, it then presented back to them opportunities to do what they had answered within the quiz. And actually this is very much about building community capacity, which I know that Elizabeth touched on at the beginning. The second insight goes on to talk about fragmentation of information. I think that's probably common again worldwide and not specific to Scotland, but people wanted information in one place, and they wanted it personal and they wanted it local to them. So what we developed with the help of the community was a service that allowed them to look for specific things that was local to their area. And we worked with the Alliance, who had a local assets database about local assets within every community. And using sophisticated algorithms, we managed to match what they were looking for with what was locally available. And this was actually even given a radius. So if you were, maybe you didn't have a car and you wanted it 4 miles from or 3 miles from your house, it actually localised it down to that level. The other thing that we tested was how can we also reach out for tools and independent living appliances to show them what's available on the internet. So even shopping and showing them things that were available was of interest, and that was within the Discover tools. The other important thing in Discover was that people wanted to understand better how to use technology, and there's a lot of videos about that. So if they did buy a falls monitor, they maybe wanted to watch a video about other people experiencing using a falls monitor and maybe other relevant things. So it would all be linked up together and information in one place. The third thing they told us was they did have technology, but they weren't sure how to use it. And they often told us that it was always somebody younger that was trying to explain how to use the latest gadget that they were given, and they always went too fast. They used jargon that they didn't understand, and even the simplest things they were trying to understand, they weren't grasping properly. So what we developed there was a service called Connect, and Connect is really looking at different ways to connect people up using technology. Again, an important aspect of what makes Living It Up pretty unique is that we used our community champions to actually do videos, how-to guides on the basics of technology. So how to get connected to Living It Up, how to get an email address, how to use text. And I know that maybe to an audience of this age group, you do think, well, these are pretty simple things, but actually they're a bit of a lost generation when it comes to digital, because unlike us, they didn't grow up with it. But they are keen to use it, and they're already using things like Skype, and I know in Australia you use Skype calls to connect people. We also, in Connect, used video consultation. Now, we used Cisco Jabber because that was the NHS preferred supplier, but we were trying to link up doctors to patients in rural areas, which again isn't a new thing, but the way that we were communicating and the portal we did it through was new. It was friendlier, it had step-by-step guides on how to use this technology, and it had interactive sessions if people were getting stuck. I suppose if you're within the health and care sector, if you're a nurse or a GP, you're thinking, well, that all sounds very nice and very fluffy and maybe hits the wellness and prevention agenda, but really we've got people that are coming to our doors that are really ill and really need looked after. So that was important as well to Scotland, because within the co-design process we had health and care experts, and what we developed there, when people told us they wanted to keep well, they wanted to keep more active, they wanted to share and they wanted to self-manage where possible, was a service called Flourish. And again, it's a positive service rather than being a bit negative about, oh, you've got a long-term condition, how depressing, you're going to have to look after yourself better. It was actually trying to bring a more proactive and positive aspect to that communication. One key innovation that came from our community engagement was that they felt a lot of people that lived with a long-term condition or carers that looked after people with long-term conditions didn't have anywhere to share their experiences. We came across one particular lady who had a mother who had recently passed away with dementia, and at the group she actually bumped into somebody whose father had just been diagnosed with dementia, and the amount of information and knowledge transfer they two did together, we tried to replicate in a digital fashion through what we call experience guides. So the experience that you have living with a condition and the experience that you can maybe give to others, they're not isolated, there's other people out there, but also some of the tips, some of the things that worked for them was really important. So we started developing experience guides around a whole host of areas, equally around how do you keep well, but importantly, how do you deal with falls, how do you deal with chronic diseases like COPD, heart failure, diabetes, etc. And these are really popular, and the good thing about them is it's the community keep them up to date and active. The other thing was when people told us that they struggled to understand clinical information, we had an innovation that came through Living It Up called digital postcards. And what that would be is your GP would prescribe that postcard to you, maybe on a thing like COPD, and a consultant would talk you over again what COPD was, how you can look after yourself better. It would then go on to maybe an expert nurse that would then talk about what you can do to keep well with COPD. But importantly, it would go into the third layer, which would be an expert patient of their experiences living with COPD. And this, again, was very important because a lot of people said that when they were diagnosed, they went home to their family and to their carers, who, again, they were trying to reiterate what the doctor had told them about the disease, but they weren't getting all the facts and figures. And it's a good way that they could actually engage what we call their circles of care, people around them that looked after them with that long-term condition. But on a wellness perspective, they also wanted to keep active. So how many times did they exercise? What did they do with their day? And actually trying to keep a log of that was really important. Now, because they told us and the digital service was really important, it was about being personalised. What we did within the digital service is no different from what Amazon do, what TripAdvisor does, what your holiday companies and your banking does. It personalises it to you. It uses a profile behind the scenes to actually feed your dashboard with things that you've maybe been to in the past through Living It Up, or things that maybe have arrived in Living It Up that you might be interested in. And that was really important because people then went back to that and could find things easily. This is probably a good point to talk about. These interventions can't just stand alone in the digital world. They have to be embedded within pathways. So 5 key interventions that are being embedded within pathways: video consultations, exercise prescriptions, volunteering social prescriptions, caring coordination planning, and mobile and health monitoring, depending on your condition. These would all be prescribed by the clinician and the care worker to actually be developed for the end user. So Living It Up developed in the 3 years it was working through the programme a new model of care. And what it allows the service provider and the end user to do is actually step up so it can keep well, self-support itself at the bottom of the pyramid. Maybe when things get a wee bit worse, they can then step up to supported self-management, where there's a clinician or there's a care worker working with them and it's prescribed to them, to much more intense care and chronic case management. But the good thing is they can actually step down. Once people get stabilised, what the service provider said to us was, I can't get them off because they've come into the system and I don't have anything to offer them now that they're stable, allowing them to actually self-manage on their own. So Living It Up developed step up, step down, and potentially step off. Now, you can step off and you can come back up and step up later on if required, but it gave a full spectrum of what we call a menu of options that's provided to the end user and from the service provider. When we talk about technology, the platform is pretty vast. It has main principles within it. One is use familiar technology, so we don't want to buy more and more kit from providers where we don't have to. It is driven by users' needs and it's driven by co-design. We've brought in things like sharing a common profile, so I can share information with my carer, and we use familiar internet accounts. So rather than me having a Living It Up login and password, I could use Facebook, I could use Google, and we've also introduced the My Account, which is the Scottish Government One account for people over the age of 60. It's a federated approach. From a technology perspective, we have open APIs and we encourage people to get involved. So providers, it's about interoperability for us. It's about increasing choice and increasing options for the service and the system, but also for the end user. So if they want to bring their own device, we would hope they could. The other important aspect, it's user generated. So again, we're building capacity within our system because we're actually getting the users and the real experts to update it and refresh it. And we have content and campaigns. So it's very much like a consumer offering where we actually email newsletters out to them every month about fun things they can do and equally about how they can look after themselves. So you might think after this webinar, it's a website. Well, let me tell you, Living It Up is a website. It is a digital service, and it promises to transform health and care, to inspire people to build their confidence, to allow them to support themselves. But in essence, it's about behaviour change. It's about getting people to actually move from where they are today to a much more active and better quality of life, and really deliver a community that's thriving. There's lots of other innovations in Scotland, so I know I spoke about Living It Up, but this slide just demonstrates some others that that we're dealing with. Falls is high in the agenda, other ways to manage and re-enable people, interactions with care homes, and even communication when the accident emergency service are out back to the hospital. So there's lots of others to look at from Scotland's perspective. It's not easy. Innovation is really hard to do. You need vision, you need leadership, you need good service innovators, and you need to think differently. It has got to be a bottom-up approach, but also complemented by a top-down approach. Policy changes are essential. Integration of health and care will really aid, but you have to have social acceptability. People have to be ready for the change. You have to work in partnership. Some of the benefits that Living It Up has seen, we have seen increased team working between multidisciplinary teams. There's key innovations in change management, more co-design, more responsive services. Carers are feeling better supported, and we at Living It Up gave people the space to innovate and not to fear, oh, we're going to fail at this one. And that is really important if you are trying to innovate your services. We've got some really good testimonials. We today have 20,000 users on Living It Up, but we have around 55,000 hits every month, and active users from service users, practitioners, to end users and carers and people that just want to look after themselves. There is some barriers. It's not been an easy journey, and I think some of the kind of top tips is make sure you bring the right people to the party. Evaluation and evidence-based, traditional evaluation and evidence-based methods aren't really fit for purpose. You really have to stop and even innovate at that level. And also the models of payment sometimes is a barrier. If I go on to the next slide, the healthcare professionals, these are often the questions they ask. What's the governance? How do I deal with information? How do I tell my patient which application to use? So there's still a lot of resistance. And I wouldn't even say it is resistance. I think it's lack of knowledge and understanding of the benefits that technology and digital services can give end users. I think the important thing to remember is expectations are changing. Traditional systems will just not be sustainable, and you do have to orchestrate that change. It can be a painful process, and it can take longer than 3 years. But I think with the right will and the right push from the entire ecosystem, you can make it happen. And Scotland has certainly started to move in that direction. We've not completely cracked it. Having lived through it for 3 years, I would say you've got to be brave, you've got to be courageous, you need enthusiasm, you need lots of energy, you need a lot of good people around you. But I think one of the secrets is to focus your energy not in fighting the old system, but in building the new. Many thanks.
Thanks, Janette, for a thought-provoking presentation. I'm really keen to understand what has motivated Scotland to lead this agenda.
Well, I think when you look at Scotland, we have some major drivers like most countries in the world. We have the demographic shift, we have the use of technology, we have major budget cuts due to the economic crisis, and actually we have a need to actually digitalise services because the over 50s have got smartphones. The generation after that expect a digital service to be in place. They want convenience. They don't want to, do the traditional models. They can't even understand why we are still doing the traditional models. So I think Scotland is no different from any other country in the world. The drivers are probably similar.
Thank you. Internationally, some governments are struggling where to begin to embrace digital disruption in health and care. I understand Scotland's agenda is wider than a financial one. Could you elaborate?
I think in Scotland, it's about creating the right environment and the right sustainable model for the future. And, there is places in Scotland that doesn't have a great track record in health, and it's really about prevention. Scotland have got their eye on prevention. It is a really difficult thing to do because the thing with prevention is it takes longer than the government models. When governments are in power for about 3 or 4 years, they don't reap the benefits of prevention. So often they can't justify it. However, Scotland realises if they don't look after their young, their 50s to 60-year-olds, they're going to have a bigger burden later on.
Great. We have another question come through from a participant from Western Australia. A big challenge for Australia is the geographic spread of our population. Do you have a particular view on making this work in more remote areas?
Well, I think one important point with Living It Up is it obviously had rural areas involved. And one thing the rural community told us was nobody actually goes and speaks to them because they're too far away and they're a minority. So I think engaging with your rural community is key. Some of the innovations that we've found useful to rural communities is video consultations. Also the peer-to-peer support online, where they maybe are in a small community and they're maybe unique, they've maybe got a disease that nobody else has, and actually allowing them to speak to others within other communities is really important. Again, social isolation for those that are getting older is a key factor, not just in rural communities but also in urban communities. So I think what was really interesting was the co-design and community engagement we did. Actually, the insights were similar in rural and in urban areas.
Thank you. We have one more question come through from a participant in Queensland. Achieving scale and widespread buy-in is an issue. What were some of the important features which made your project successful and sustainable?
Achieving scale is really hard, and I think we know that because we've got enough small pilots to prove they can't get beyond the hundreds. Living It Up did set their target really high. We looked at a completely different model, and we looked at over tens of thousands of people getting involved. What makes it scalable is actually delivering something that people want to engage with. And also, I would say using familiar technology, because sometimes one of the barriers is the hundreds pilots are good, but actually the cost of scaling them up with the capital expenditure is just too high. So what we're doing is we're leveraging on assets that the community already have, they're comfortable with, and can be scaled pretty rapidly. And I think that is certainly the future for health and care and wellness applications.
Great. Thank you very much for your time today, Janette. And you can contact us for further information on our contact details on this slide. Thank you again.
Thank you.